In this episode, I talk with Dr. Karen Gellman, who specializes in biomechanics. She's part of a team of people who created the Postural Rehabilitation program. And today we're going to be talking about equine dentistry and posture. It is so full of valuable information, it is not to be missed. Dr. Karen Gellman is a graduate of Cornell College of Veterinary Medicine and has a doctorate from Cornell in animal locomotion biomechanics. She has advanced training and certification in veterinary acupuncture and veterinary chiropractic and has practiced these and other holistic modalities since 1995. She teaches internationally about posture, locomotion biomechanics, equine dentistry, and veterinary complementary therapies to veterinary professionals and allied professors. She is a wealth of knowledge, and I'm so excited to be able to talk to her. So here we go. Episode 213, Equine Dentistry and Posture with Dr. Karen Gellman.
Hi, I'm Karen Rolfe, and welcome to Horse Training in Harmony. This podcast is about you making progress with your horse in a way that you both can love. It's about learning how to move and be in harmony. Because yes, you really can develop a horse to be both athletic and happy. When we show up as our best selves for our horses will show up for us. So let's get started.
Dr. Karen Gellman, welcome to the pod. Thank you so much for taking the time to be here.
Oh, it's my pleasure. Always a pleasure talking to you, Karen.
Yay! Yeah, likewise. So last time you were on the pod, we talked about the importance of having a really multifaceted approach to helping our horses. And this time, we're going to be focusing on one of those facets in particular, which is teeth and dentistry and the effect of all of that on posture. So I'm really excited to talk to you more about this. It's so important, and you are just a wealth of information. So yeah, so thanks.
Oh, thank you. It's funny, the dentistry side of this is something that I learned from our mutual friend, Dr. Shoemaker. And it's the part that is really surprising to a lot of people because it's totally clear that if you're wearing the wrong shoes, your feet are going to hurt. I mean, that part is easy for people to get. And if your neck hurts, like, yeah, you're not going to stand up straight. Those translations between our own posture and our horse's posture are pretty apparent. It's like if you wear a pair of high-heeled shoes to go to a wedding, your feet are going to hurt at the end of the day if you're not used to wearing high-heeled shoes all the time. I mean, we know that intuitively. The dentistry stuff is it seems so off the wall, and yet it's so critically important. And on my Facebook feed this week, I saw someone shared a post from Tomas Teskey. You know Dr. Teskey? He is a great equine dentist and veterinarian. And what I loved about this post is that he kind of put forth this global view. It said, like, domesticated horses need our help wearing their feet because they don't move enough, and they need our help wearing their teeth because they don't graze enough. And he accompanied this with a photograph of one of his own horses who is out grazing on abrasive grasses for 18 hours a day. And the horse is 27 years old, and the teeth are short like a youngster's. So getting long in the tooth is an artifact of domestication. Because, yeah, go ahead.
Sorry.
I know, it's so exciting.
Artifact of domestication. Pause for Karen to interrupt. Yeah. No, that's such a, again, that makes so much sense. It's like wild horses don't need farriers and trimmers as much, right?
They
Because they do
don't.
the thing. And I think before we get really into the details of the teeth, I just wanted to kind of emphasize like the power of having this holistic approach. Because I think for you, it's like a no-brainer. Of course, we have to look at all these different facets, but I think it's absolutely vital, no matter what we're doing in the horse world, no matter what our specialty is in the horse world, we need to look at the whole picture. And I think humans tend to specialize and focus on, everything is something to be fixed in their specialty. But we think about what's affecting our horse's well-being, right? How they feel, how they eat, what they eat, where they live, how they move, how we ask them to move, how they feel about us, right? And it gets complicated. But for me, I think the more we can be aware of all these different pieces, in my experience, I've found you can make small changes in a bunch of areas, and then like something happens where they all start to help each other, right? A
Yeah,
little
there's a
change
synergy.
here makes a little change here, and instead of just looking at this one thing and going, why does my horse's pelvis, keep or need adjustments in the pole? Well, because the feet, right? So I think I just wanted to emphasize, I think something that's obvious to you is just the importance of the holistic approach. I mean, I've learned to do it as a trainer. I don't look at everything through the eyes of a dressage trainer. I'm trying my best to think, what are they eating? How are they eating? How, all of this stuff. So yeah, anyway, I just wanted to interject that really quick because I can feel you're
Yeah.
gonna go right into those teeth and
Well, it's hard to both look at a close resolution and keep a faraway resolution. And that's the trick, isn't it? So, I can look at your beautiful face as we're talking on Zoom, and then like you have cells that are doing all kinds of stuff. I don't need to look at your cells right now, but like maybe your doctor does. There's all layers of resolution within all of us, and that's what makes it so cool. And what we're teaching in postural rehab is that complex systems are all of these things interacting, and there are points of maximum influence that you can poke at to try to make change. And that's the genius of our friend Judith, Dr. Shoemaker, is that she discovered, kind of by trial and error early in her career, that the three biggest things that help you make changes in improving horses' lives are the feet, the teeth, and the pole.
yeah. I remember that from Dr. Shoemaker when she would come out to Long Island. She was doing the adjustment. So, she would come in, we're like, oh, a chiropractor's coming in. That's the only words we had to describe her. And she's so much more. But she's, the adjustments we could all see, but she just kept going teeth and feet, teeth and feet, teeth and feet. And, after saying that enough times, I finally got it. And of course, I ended up having a horse that needed the
Yeah.
feet.
Yeah, it's
And,
usually one horse that really
it changes
reveals
everything.
all of that stuff to you. And
Yeah.
it's really transformational.
Yeah. Yeah. All right, so now let's let you get back, talking about how wild horses don't need dentists, right?
Yeah, so like, the grazing itself, when they're biting off the grass, I mean, grasses themselves have abrasive substance in them, like silica. And then they're, biting the roots, and that's going to have, the dirt with it. So they're going to be wearing their incisors if they're grazing a lot. But our horses get hay because we don't have enough room for them to graze. We don't have the management area to send them out to 500,000 acres and saying, okay, we'll come back when I need you. It's just not convenient to let them graze as much as they want. And that's why they need our help. So the long in the tooth is a horse who's lived their life eating hay that's pre-cut forage and not having their incisors addressed by a skilled equine dentist. So the knowledge and understanding about how the incisors and the back teeth, the molars, work together in the horse is something that's kind of just trickling into everybody's understanding right now. There was a big revolution with equine dental care when power tools started being used. Before, it used to be, let me tell you, when I went to vet school back in the day of the dinosaurs, I graduated in 1995, and I made an appointment with the um, ambulatory professor to come and float my horse's teeth. I mean, I was so dumb that I didn't know horses' teeth needed floating until I learned about it in school. So I made it a point for her to come out, and she goes, "Nope, I'm not going to come and do it. I'm going to show you how to do it." And she came out with a bucket and three floats and said, "Here, now, this is how you do this one." And she goes, you know, shoves the float in his mouth and takes off the point and says, "You hear that sound? That's what it sounds like when it's done. Here, you do the other side." And then she did like, the upper teeth. First she did the upper teeth, then she did the lower teeth. Then she says, "Okay, you're licensed to float."
Wow.
And that was my dental education in 1995. And I really didn't have a clue that there was more to it than that. So there was kind of a revolution that happened between 1995 and 2000 when I met Dr. Shoemaker, because power tools really took off in equine dentistry. So what's so great about power tools is that you can accomplish a lot and not get so tired. But you can also, as Judith says, putting a power float in the hands of anybody is like giving a monkey an Uzi. You can do a lot of destruction really quickly. So a lot of people got very excited by the ability to really change, for instance, the incisor occlusion, and they overdid it, and they created uh, opened up the pulp cavities in the incisors
Oh,
and killed
wow.
the teeth.
Oh,
So there was an enormous backlash from the advent of using power tools from the overenthusiasm of the practitioners. And the practitioners who were overly enthusiastic were not just veterinarians, but also non-veterinary dental care providers. But nobody talks about that veterinarians were equally responsible for this. There's been a lot of concern in the veterinary community that non-veterinary dental care providers are not educated enough to do the teeth correctly. So this is an area of huge political consequences. Um, Here's how I like to explain it to my clients and also, the students who are teaching about PR. So let's say you decided, Karen, I see, your beautiful living room there. You wanted to have a built-in bookcase and um, sewing center, and you wanted it to match all of the furniture that you had in the rest of the room. So you called in a cabinet maker to retrofit everything, make this beautiful built-in bookcase, have it look like everything you wanted to do be perfect. Everything fits together. It's lovely. Now, a skilled craftsman like that did not take a shop course for 6 months and emerge being able to create a fine bit of cabinetry. It took years of learning the basics and then apprenticing with a master and then doing work supervised by the master carpenter until finally they became good enough so that they could do work without supervision that meets a level of quality. And hopefully, the quality that you want is very high. So it's the same thing with occlusal equilibration. Occlusal equilibration is restoring the perfect and normal relationship between all of the teeth together. And that means the front teeth and the back teeth. So if you're going to restore that functional relationship, you need to not only know about the anatomy, about the neurology of how these are working together, about the physiology of mastication, about how the TMJ works, all of those things. You need to know the conceptual, but you also need to study with a master for a long period of time so that you get to observe, hundreds of different presentations of a similar kind of problem. So you see the different ways that you might address the problem depending on the horse's environment, the horse's age, other concurrent conditions. And so that you can come out of it with someone who is able to really be an occlusion doctor. Now,
wow.
that person could be a licensed veterinarian, or that person could be a non-veterinarian who has dedicated their life into learning those skills, doing it at a very high level, getting an education, apprenticing with a master for 3 to 5 years, having supervised work for a number of years, and going out and practicing. The work that someone with that kind of training can do is very different than, let's say, the work that I could have done as a newly graduated and fully licensed veterinarian. because there was nobody to teach me, and I didn't even know it was important. So, general practice veterinarians are very good at general practice and being able to manage all the different aspects of your horse's healthcare. But would you send your child to the pediatrician for orthodonture? I don't think so.
Yeah, yeah, I find I mean, my vets, normal vets, I mean, rarely look in the mouth just as part of a general, you know,
They've
practice.
got plenty else to do.
Yeah. I could remember back in the day, I remember it was my farrier who used to float the teeth and just, he just filed stuff.
No,
And there was
floating,
some.
floating is a
Mhm.
different thing.
Okay, yeah.
Floating is
Yeah,
taking off sharp points. So
right.
that's what my professor taught me in my horse's barn. That is taking off the sharp points. So why do horses have sharp points? Well, they have sharp points because the mandible, the lower jaw, is much narrower than the upper jaw. So if you look, on a horse skull, you'll see the bottom of the jaw. It's kind of what makes horses so beautiful, is that they have this very delicate lower jaw, and the whole head where the eyes are set is much bigger. And so it tapers and it's very beautiful. Well, in order for that narrow mandible to grind, they have to bring one arcade over to the upper arcade. So they can only chew on one side at a time. And a lot of people don't realize that. You have to chew on one side at a time when you're a horse. And one of the ways that you can assess whether there is any kind of problem with your horse's mastication, with their chewing process, is by watching them eat for a half hour and seeing if they switch sides. So a healthy horse will chew on one side for 10 minutes, and they'll switch and chew on the other side, and they'll switch back, and they should spend about the same amount of time on either side. So if you go out and look at your horse eating and they only chew on one side, that's a sign of a problem that you should have checked out by someone who has some training in the area.
Nice. Yeah. And you have this really beautiful handout that I'll make sure I'll put a link to in the show notes about this. And one of the things you mentioned in there too, even with the floating, is that in order to use the rasp and the float to do it, you have to be behind the point and then be able to pull it forward. And you can't
Right.
really get to the back teeth, right, by doing it
Well,
that way.
I kind
So,
of forgot to move on about why the chewing on one side makes sharp points. So
okay.
chewing on one side, it means that when they bring it over, it kind of the whole like our teeth are kind of level where we chew because we're pounding chewers. But horses' teeth, they're grinding side to side and front to back. So their teeth are at an angle. So that angle is like an A if you looked at the horse head on. So that angle in the grind means that the upper teeth get a point on the outside and the lower teeth get a point on the inside because they're essentially grinding away and then coming away. And so that leaves a sharp edge. So those sharp edges are what's taken off when the horse is floated. And it's not a high level skill floating. It's just using a file and taking off the sharp edges. Now, do horses in the wild need to be floated? No, because they're not wearing bridles that are pushing the cheeks against the sharp points. Horses in
Gotcha.
the wild also eat different food at different times of the year, and that tends to even out their dentition and knock off the points and things like that. So points aren't a big problem for wild horses.
So interesting. So with the incisor work and say that term again, the dental equil
Occlusal
occlusal
angle,
no,
okay.
you called it, what's it balancing
Occlusal equilibration.
occlusal
Occlusal
equilibration.
equilibration.
Say
Yes.
that three times fast. Occlusal equilibration. Um,
Yes.
one
I've had a lot
thing,
of practice.
yeah, that rolled out earlier. Yeah, and the effect on the TMJ joint, and then the effect of the TMJ joint on their ability to see where, proprioception of where they are in space and how that affects the posture. I mean, that was one
Yeah,
thing
that's
that
a
Judith
really interesting
really,
connection.
and that, so it's all snowballing into one thing starting to affect the other. And in that handout that I'll link to in the show notes, there's this really cool exercise that you walk people through. And I was wondering if you could maybe just walk people through that little exercise quick, because I just did it in my kitchen a minute ago and I'm like, oh my God,
Wow. I know,
like,
it's like mind blowing.
whoa.
It's
Like,
mind blowing.
yeah.
Yes.
So
So
maybe talk a
so
little bit about
basically,
that.
the demonstration here is that the TMJ is hardwired to the brain for balance, because when you think about it, it makes a lot of sense. Because if the TMJ is like right here next to your ear, like if you go right in front of your ear, that's where your TMJ is, and that plane is like the base of your brain pan. So it's like really, really close to the brain. So the brain has made a system to make sure that there is always a leg underneath where the TMJ is, so that you don't fall over and let your brain come to unceremonious contact with the planet, as Walter Carrington put it. He's a famous Alexander teacher. So, what you'll find, so if you sit in your chair or stand up, just don't have your hands in your pockets. So you can sit in your chair with your hands on your side, or stand up and just like stand on level ground, hands at your side, and play around with working your jaw. So if you're just standing there, you should feel your center of mass, which is kind of at your belly button, being a person, and that will come down between your two legs, and that is, a neutral balanced stance. If you take your jaw and move it all the way to the right, as far as you can, all the way to the right, you will probably feel a change in your balance. Now go up to neutral and move it all the way to the other way, the left. And if you're sitting, you'll feel a change in the balance on your sit bones. If you're standing, you'll see that your feet, because your brain is trying to keep your leg underneath where your jaw is. It also works front to back. So if you stick your jaw all the way forward, you'll probably tip forward. And if you pull it back, you'll tip back. So this is proof that you are hardwired to pay attention to where your jaw is. Now, equine teeth are not like ours. They are what's called hypsodontic, meaning that there is a big, long tooth that is up in their sinuses and down in their jaw that is being ground away all the time, because horses should be grazing for 18 hours a day. So if they're wearing away their teeth at all time, there is lots of reserve tooth to keep erupting. And that is the way that a balanced mouth should be. You're grinding away some tooth, you have more tooth erupting. And since they're always erupting, if you have an asymmetry in your mouth, front to back, side to side, and often all of the above, you're going to have changes in how your teeth are meeting. Then those changes become a negative feedback loop to the changes in how you stand and how your hooves are going to respond to weight bearing, how your muscles need to compensate. All of those things can happen because of the unique nature of horses' teeth and the kind of stuff that can happen living with us. Or the stuff that can happen just from being a horse. So let's say you've got a youngster out in the field with a bunch of yearlings, and they're playing around and being dopes, and somebody gets a kick in the face. Well, they have just shifted those facial plates, and that horse can then have a crookedness in his entire skull for the rest of their life. And I know this because my teaching skull has a divot out of the orbit on one side that probably came from somebody's hoof, and everything is torqued in that skull. The teeth are at an angle like this, and every plane of that skull is twisted and torqued, and you know that the rest of the body had to compensate in order to go straight down the road. So You can go down the road straight if you're asymmetrical and twisted, but it's a heck of a lot easier when you're symmetrical.
So interesting. Now, thinking about how horses, modern horses are eating, and that can change the teeth, and that can change their balance, and that can change their posture, and then that can change how they're ridden or what they need to, what the trainer might need to work on. And so we can see it going that way as a rider trainer and trying to like loosen and balance the body in motion. I cannot work the other way around. Can bracy riding create a tension that changes the posture, that changes the TMJ, that changes the teeth? Do you
Um,
think? I
I
mean,
think that most people these days ride their horses for very brief periods of time. So I don't think that the influence of the rider is long enough, like, out of any given day, it's at most going to be like an hour. Whereas the other influences, like how are they eating and where are they standing? Do they have a level place to stand? Things like that. Those are going to be more prominent influences on the dentition, on the feet, on the body than the riding, because the riding is going to be a very intermittent influence. But things kind of work together. So, like, if you have a horse who's being ridden with, let's say, a really crazy saddle that has a broken tree and the rider didn't know it, and the rider has all kinds of body compensations that they're doing because they don't realize how much the saddle is changing them, the horse could develop a habitual cringe from the discomfort that's imparted during that period, and then that could like last over to other periods. So I would never say that it's not important to have, a balanced rider and a well-fitting saddle that doesn't have, a broken tree and things like that. But the big difference is the intermittent nature as opposed to the 24/7 nature of the horse's body living with gravity.
yeah, no, that makes sense as far as the literally the amount of time spent.
Mhm.
I think in my experience, because I've had a lot of anecdotal reporting of people who break the cycle of brace through the riding, that then their trimmer or farrier starts saying the feet look better or the this, and I think maybe it's just
Mm.
if you're changing and improving the feet, if you're changing, improving how they're eating, and you're changing these things, the riding is a place where braces can either be reinforced or dissolved and can
Yeah,
help the cycle of healing work better.
all these things are stuck together so well. So, I mean, I absolutely agree that you can fix so much with the writing. Like, oh, I'm blanking on his name. Jean-Luc
Oh,
Cornell. Yeah, Jean-Luc
really?
Cornell does absolutely gorgeous work from the saddle, doing a lot of the kind of postural resets that we're doing from the ground. So you can make such a difference through the writing. What I tell my students is that the writing, like the manual therapy, like the chiropractic, is working on the function aspect of the horse. Then we're dealing with the structures, which are going to be the feet and the teeth. So a horse, even if they're getting fantastic functional input, will have a difficult time progressing through if their structures aren't corrected. And they can't do this themselves. So, I mean, a horse, however beautifully ridden, can't change their management to get enough exercise to wear their feet. They're always going to be in that field that maybe doesn't have enough abrasive qualities or doesn't have hills or doesn't have, there's a limitation. Horses don't get to choose their exercise program. And similarly, the dentition, it's very complicated. You can't just say, oh, well, I'm going to give my horse another hour and turnout, and that'll help fix the teeth. And it's like, it doesn't work that way because when you have patterns in the mouth of malocclusion, they tend to reinforce each other. I think you mentioned this before, and in particular, the grinding pattern of herbivores, so horses, cows, goats, all those guys, they're spending a lot of time chewing, and they're chewing in mainly a circular pattern on one side of their mouth. And there's a very complicated neurologic thing. I could show you the slides of how it works, but it doesn't matter. The point is that they're grinding in a circle, and their teeth are designed to have a wonderful grinding surface. Like if you've ever looked at photographs of people have decorations of old millstones, and you'll see that there's the stone surface and then there's grooves in them. So the horse's teeth are like that. They've got these enamel ridges that are going around and back and forth. And between the enamel ridges, the enamel is the hardest substance in biology. They have the dentin, which wears away more evenly. So as the horse or cow is grinding their food in those lower areas, the ground up and pulverized foodstuffs gets to flow out and go get swallowed. So I forgot where I was going with this. It was something important.
No,
Oh, yeah. All right. So there's a circular pattern, and what this does is that the upper teeth and the lower teeth are these grindstones, and they're grinding against each other. So what happens typically with our patients who have abnormal compensatory posture is that something has happened in their life that is restricting the front to back movement. So the front to back movement starts getting restricted, and that can be a little bit of an overjet. It can be like a wave mouth. There are a lot of different things you may have heard of that can restrict front to back movement. But here's what happens. When the horse can't chew front to back, they only chew side to side, and that digs the rut deeper and deeper and deeper. So once you have a restriction of front to back movement, any small side-to-side abnormality starts getting deeper and deeper because the horse is only chewing side to side and just grinding away at it. So when you see a horse who's had a front to back restriction for a long time, we can see really, really dramatic things. I think there's a photograph in the handout of an 8-year-old racetrack pony with these really dramatic, like a big hook and the ETRs. And that happened in just 3 years because horses' teeth only come into full occlusion when they're 5 years old. And if they don't get the right kind of dental care as young adults, they can have this thing where the teeth are erupting very, very fast. And they just keep grinding away into these very severe patterns. So the most important years for getting very good dental care in horses are age 5 to 11.
Interesting.
The eruptions start slowing down when they're teenagers. And then by the time they get to their 20s, there's very little eruption at all. So you have to be very careful working with geriatrics so that you leave them enough teeth to chew with.
So interesting. Yeah. Very
Nature
cool.
is amazing.
Yeah. 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 And it's just, again, it's so, I love that we're talking about this because I think there's something about, the mouth is closed. Feet we can see. Feet we can see,
Right.
but there's this whole stuff going on inside their mouths, and it's so worth bringing attention to it.
Right. So, I mean, we can see stuff in the incisors. Those are like right out there for the world to see, if the horse will let you. You don't want to look at them with the horse's head up in the air because actually, like if you'll notice, if you put your head up, your jaw will change position relative to the front teeth. So if you're trying to see whether your horse has a reasonable occlusion in their front teeth, their incisors, you want to let their head be in a kind of neutral position. And you can just part the lips and look from the side. You can look from the front. And what you want to see is, does the center of the front teeth on the top line up with the center of the front teeth on the bottom?
Yeah, that's a great, very simple
Very simple.
first check to do.
Yeah.
Now, if somebody was, if somebody's like, oh my gosh, I need to have one of these special trained dentists come do my horse. Like, do you have any?
So there's an organization called the International Association of Equine Dentistry in the US, and they do a certification program for both veterinarians and non-veterinary dental care providers. So if you go to, I think the website is IAED Online, and they have a search list. You can search for a provider in your area, and they will give you a choice. I mean, there are members of the association who haven't been certified. I would say go with a certified member because they do have to pass a pretty intensive practical exam showing that they have the training to do an occlusal equilibration.
Awesome. So that's IAED online, and I'll try to find that link and
Yeah,
put it
I'll
over.
get you the link.
Okay.
In Europe, I don't know if there's a lot of our listeners who are in Europe. In
Yeah.
Europe, there's a similar organization. And I can never remember the acronym, but you should be able to find it fairly easily. And again, it's an organization of very high level dental practitioners. It includes both veterinarians and non-veterinarians. They have a meeting every year in the same hotel in Germany. And I was speaking at their conference one year, and I can prove it because I have these photographs of me with this giant horse mouth that one side is perfect teeth, and the other side is all the terrible, terrible things you can see in horses with bad dental care. So I'll show you those pictures sometime, Karen. You'd love to see.
Yeah, I'd love to see them. And then any quick tips, on this about management. Like you said something earlier about you can't just increase their pasture time for an hour. Like what are some, do you have like a must-haves or something that people could change that could maybe help? One thing that you said early on that clicked in my brain, it's not just about eating off the ground, but it's the actual act of pulling, pulling
Yeah, yeah.
and just thinking about that and just thinking about the whole neck and body involvement and just that little like how that acts on their pole and everything is, and I'm sure it's stuff going on inside their mouth that I'm not aware of, but are there some like must-haves or definitely
So when
don't?
you think about it, like a horse in the wild, a wild equid, the zebra, or a donkey or a Prasowski horse, all these wild horses, they're making their living grazing. They're grazing for 18 hours a day. And that is a repetitive activity in the same way that locomotion is a repetitive activity. And if you can visualize a horse like biting the grass, and they're going to fully extend their head and neck, they're going to pull it up, which flexes at the pole. And that should ring some bells for you, Karen, because that's what you see Judith doing as part of the work that she does with the horses, flexing at the pole. Horses in the wild also drink water below the level of their feet. And you'll see a horse drinking water like that, and then kind of like shaking their head up and down, back and forth. And all of those are really essential resets for the pole and the postural control system. So anything you can do that gives your horse more time being a horse,
Mhm.
being out with other horses in varied landscape, eating grass, drinking water below the level of their feet, all of those things. I mean, you can't say to somebody, oh, you must do that because it's just not available to everybody.
Yeah.
It's not.
But
So what can
there
we
are things
do?
you can do though. So
Well,
like
you want to have a
we
skilled
have
dental
automatic
practitioner.
waters that, sorry, I'm talking over
Oh,
you.
yeah, yeah, go ahead, go ahead.
All excited. So like we have automatic waters that stick up out of the ground.
Right,
But then I
right.
also have a second water thing in everybody's pasture that's a tub that's on the ground. And just by the nature of them standing at it, it's now kind of down in a little hole. And we
Yep,
put apple
yep.
cider vinegar, a little blop in there so it tastes good. And they love going to that also.
Yeah, that
And
sounds fantastic.
and sometimes I feel bad about like my husband always wants to like get the tractor and put more dirt in. And I'm like, no, no.
No,
Let's
it's fine.
let's leave it down down in the hole. So
So many of the things we do is for our convenience. So it's like, why would you bring it up? Well, it'll be easier to clean if it's higher.
yeah, or we don't have a little puddle, but
Eh, right.
it's like the yeah. One other question I had that I know other people are gonna ask. Like I have some of my horses that can't be out grazing because
Right.
laminitis, metabolic stuff. So we have hay nets or the slow hay feeders. Like what are some um tips that are best for the dental or just in general. Low hay nets, hay nets up in the tree, down, reaching. I know there's a million choices, and I have what I
Yeah.
do, but I'd love to hear.
So, Dr. Shoemaker has advocated for feeding on the ground for all years. She says it's fine. You can have a hay net, and most horses will pull it off and eat from the ground. Um, Dr. Sharon May Davis, who is our expert on ECVM, she has a paleontological timeline that she looks at. And some of the really early horses were browsers rather than grazers. So what's the difference? A browser is eating off of trees and a grazer is eating mostly grass. So the modern horses are definitely grazing as a predominant thing. I mean, you can look at these timelines and the paleontologists, like there was a line where, a line was drawn where horses became grazers, but they benefit from browsing sometimes. And Sharon feels happier with their teeth if horses have some variation in their feeding heights. And she goes, you can accomplish this by feeding on a hill. Now, other people don't agree with that. I'm just putting it out there that it's okay to eat from a high hay net occasionally, but the most predominant eating position for horses should be on the ground. And for
Yeah.
horses who need to restrict their amount of eating, the creep feeders are very useful. And there's so many do-it-yourself ones that you can figure out. I was just doing a lecture on this, and I couldn't believe the variety and ingenuity that people have figured out to make slow feeders. I mean, you
Mhm.
have to be careful if you have horses with shoes on. You
Right.
have to be careful that you don't have nets where their shoes can get caught in there. But there's a lot of ways that you can manage this. And if you have horses with insulin resistance, you need to figure out a way to have the kind of hay that they can eat. So it's like this, if I have to find the sweet spot to have
Mhm.
hay that has low enough sugar that it's not going to trigger problems with their insulin, but is still palatable.
Yeah.
So you're like looking for the worst hay, but it can't be so bad that they won't eat it.
Yeah. Yeah. And
And you
I've
can test.
done that dance.
Yeah. Your local agricultural society, your local what do you call that?
The ag extension kind of.
Yeah, the ag extension. Yeah, yeah, yeah. Cooperative extension, they call it here in New York State. They will help you test hay. It's very reasonable to test your hay. So if you have a horse who has metabolic issues, you can't restrict their eating because that's what being a horse is. I mean, they're supposed to be eating
Yeah.
all that time. And when they don't have access to hay 24/7, you can have all kinds of problems with anxiety, stress, GI problems. All of that stuff is going to come from inhibiting what's an essential horse behavior. So you need to find a way to let them be a horse and not have them be ill from these other things. But there's also, I mean, we've had this conversation before about like a horse who has inflammation from insulin resistance may have another source of inflammation. And when you reduce the overall inflammation, the supposed problem can be reduced as well.
Yeah, I feel like that is the theme of myself and my horses is reducing inflammation. But I've done this dance, and so I have hay nets of different size holes, right? So that's not always the same. There's small and there's not as small. And, the same thing, like we hang the hay nets lower or higher or down close to the ground, but then we have fire ants, so we have to kind of play a little game
Oh
there.
yeah.
But I observed my horses, and one day I'm driving down the driveway, and I'm like, they're all standing with their front feet in a little hole and their butts in the air. And I went, oh, no, no, no. So that's when we got the tractor out, and I created these places where I could hang the hay nets such that they were kind of up a little in front and having to reach with their necks and putting the hay net maybe a little bit behind something and then
Uh-huh.
hang some in the tree because here they'll pick the Spanish moss out of the tree. So the variety, like what you were
Yeah,
saying, I just
variety. It's
want
good.
them to have different size hay, and we play hide the hay net so they go in different areas. But
Yes, that's
um,
enrichment.
exactly. So I have to
Enrichment.
look for it, and they do get some grazing time, and based on the time of the year, I have to, more or less, and I get the hay analyzed and mix their minerals accordingly. It's a whole game.
Yeah.
But I think that the thing that us humans do is we find something that works, and then we just keep doing that. And a lot of the times that I've really helped horses is like change things up, the variety, move things around. It's how I train with posture. It's like keep the possibility of movement open in a really fluid way. And then then when there's changes, improvements in the feet, improvements in the teeth, improvements in anything, if they have a body and an interaction with their rider that doesn't lock things in, that's
Yeah.
playful in how it moves, and they're open to exploring possibility, this is where I think everything gets in a really cool cycle of you change
Yeah.
the feet a little bit and the body feels better, and then the teeth get a little better, and then, and everything starts helping everything. And
Yeah.
that's my dream and why I love having
Yeah. I mean, you just keep
talk about it.
circling around. Just keep
Yeah, instead
circling
of a
around.
downward
And
spiral.
you can
So,
always, it's very hard because sometimes you can't imagine things being any different than they seem at the moment. And I think in the horse world, we get very enamored of tradition. Traditions have been around for a
you
long
think?
time, but the traditions were in a different world. I mean, so many of the traditions that we treasure were developed when horses were the transportation that everyone used. And, it's just a different world now.
Yeah.
And we have to consider differently, like, a horse who was a carriage horse in the 1850s worked for 10 hours a day. Or maybe they worked for 10 hours a day, 2 days a week, and then they got the rest of the time off to chill. It was a very different lifestyle. And the way, I mean, like people don't realize this, the whole idea of giving horses concentrates like grains instead of just hay is because if you were a soldier and riding the horse for 12 hours a day, that horse did not have enough time to take in enough forage to serve the nutritional needs. So they needed to concentrate their nutrition into something they could eat quickly. So it's an artifact of a horse working an unreasonably long day to serve a human that we developed these convenient ways of feeding them.
Wow. What a great zoom out perspective to go, wait, what are we doing and why? Yeah, I think the horse world, it could be served by doing that in every aspect. I do that with my students going, what's that piece of equipment for? Why? Why was it invented?
Right.
So I think, yeah, the beautiful thing in this day and age is we have access to so much more information to be able to step back and really look at things differently. And
Yeah. Does it serve us? And maybe it does. Maybe it does.
right, right. But then you can do it with confidence. So in the spirit of amazing information that's out there, you, along with Dr. Shoemaker, who I don't know, I think is a genius
She
personally,
is.
and
She is.
between the two of you, it's a wealth of knowledge, and so you have an
Also,
amazing.
Liz, I mean, the Alexander technique part of it is
That's right.
so life-changing.
That's right. Yes. So it's a postural rehabilitation course. I've done it. And this you're running one again coming up that's you've made for professionals. So yeah, maybe you can tell a little bit about that program, what's in it, who it's for. Yeah.
Yeah, the postural rehab professional program is to help the people who work for horses all the time to be better at their jobs, to have a more global perspective. And the one that we ran last year, we had trainers like you, we had farriers, we had dentists, we had uh, body workers, a lot of body workers. Postural rehab is particularly appealing to Masterson workers, people who do the Masterson method. They seem
Mhm.
to really groove with what we're doing. Chiropractors, veterinarians, osteopaths. So we had a wonderful group of people, and we're doing it again. And it's such a joyful process because we're trying to make our people just say like, oh, aha, I never understood why those things seemed important, and now I can tie it all together. So it's a way to pull together all of your knowledge that you've accumulated in a lifetime of working with horses and understand the why. And I'll give away the secret right now. The why is gravity. We are all slaves to gravity here on Earth, and I don't think we're going to Mars anytime soon. So let's just stick with what we've got here on Earth.
That's awesome. And one of the things there's so much about the the program was amazing. And one of the things is to have people who were trained in, trimming and feet and hooves, listening to the dental stuff and listening to the, posture stuff, and then the body workers listening to the teeth and the feet, and then the dentist listening to. So I love that you brought together all these different facets and everybody got to
Because it
hear from
takes a
everybody.
team.
It does. And
Takes
you
a
need to, like,
team.
as a trainer, I need to know when we need teeth done and feet done, so we all need to know enough about it all to be able to know when to go call the expert. And the other
Yeah.
thing I loved about the course is something you just mentioned with the gravity. So the program started, or somewhere in the beginning, with all these images of wild horses. So you have all the like herds of wild horses and all their legs are straight up and down. And you just kept showing these pictures of all these wild horses and their legs are straight up and down. And every single one. And then you see pictures of domestic horses, and there's one with, that's always grazing with the one leg way out and the other leg behind and always doing it that way, or the goat on the rock, or the all these other posture things of these domesticated horses. And that to me was like, wait a minute. Like these horses out in nature being natural, and their relationship with gravity was so much healthier than some of these, I'll put in air quotes, everybody, you can't see me, well taken care of horses in the modern era that are contorted. And, as a trainer who's used to helping horses in movement and observing horses in movement, just the simplicity of going, just go look at them and what they're doing the 23 other hours of the day. So I just would go out and stare at my horses and I'm like, oh, like, I'm doing this right. Or like, oh, that one, that's weird. And that makes sense. And here's why. And here's now what I can do. But the power of just going, just look at them out when they're just being themselves. And what do you see? Was pretty powerful and
Yeah. I
humble,
mean, it's kind of
you
like
know?
shifting your perspective of it's like, I remember, when I started riding again and I went to vet school and all I thought about was the hour that I could be riding my horse that day. So you think about the time that you're riding, you're moving, you're doing and that. A horse is spending the other 23 hours standing around. So what's going to be more important for their health and well-being? The hour they spend with you or the other 23 hours of the day? It's just like by volume. The other 23 hours are going to be mighty important.
Yeah. And another reason that just emphasizes, like in my program, when I think about it, I have what I call my happy athlete training scale, and the base of it, the most important part is like, does the horse have a happy horse life? And not just because he's in a, expensive stall with a porcelain feed tub. It's like a happy horse life. Are his horse needs being met as much as possible? And, I think it's just really cool that in the middle of all the expertise and all the, things we can do to help them, that the goal needs to be that they are able to just be in a way where nature and the horse that nature created can be sort of fine, But the truth is we
Yeah.
need to intervene because we already have intervened because we're keeping them in unnatural situations.
It's so hard to shift your perspective because, again, like you look at a beautiful barn and a lovely stall that's kept impeccably, and you think, wow, this horse really has it made. But if that horse doesn't have companions and is able to groom with other horses and is able to move when they want to move, not just when the person wants to take them out, that you're really impeding so many parts of the expression of who they are. And I'm not saying this to make people feel bad. They wouldn't have a life if we didn't get make this life for them. But I think in every situation, we should all be looking for ways that we can make our horse's life get just, even if it's the teeniest bit, closer to the kind of life they would have if they were living to their full genetic and behavioral potential.
Yeah.
Just little
Freedom,
increments will make
origin.
a huge difference.
Yes. And I think, you just sometimes have to get a little creative or just step
Yeah.
back and look at the choices. and see, I always say, see what dials you can turn. See what dials you can turn. And I think people might be surprised if they just to stop and think of like, well, what could I do to give them more freedom, more forage, more friends? And yeah, and so it's again, it's just really cool to think about that perspective. And then I highly recommend the program to anybody. It's such a wealth of information and experts in the room. I mean, especially this one for professionals. There's going to be a really neat group, I'm sure. And it's not just like training videos, but there's a lot of live Q&A discussions, hearing other people's questions. And I mean, there's just so much to soak in. So it's one of those programs where, you can just go watch the videos and listen to recordings. But if you want to talk to somebody, like you'll be talking to Dr. Shoemaker and Dr. Karen Gellman, and I forget the woman who did the Alexander technique.
Liz.
Liz.
Liz
I was
Reese.
gonna
Yeah.
say Liz. I
Yeah.
should have
So
trusted my instincts.
yeah. So
Yeah.
Liz does a full training workshop once a week. And this is such amazing work, especially for riders. I mean, it just is life-changing because just being able to understand your body use and your posture and how all these parts are working together in a really profoundly different way. It's just wonderful.
Yeah. So I'll put the links to the handout in the show notes. I'll put the link to the course, or if you're driving and you just want to make sure you can remember it, I made a nice pretty link, dressagenaturally.net/posture course, all one word, posture course. So that'll bring you right to it. And yeah, thank you so much, Karen. It's the Karen and Karen show.
Yeah, I know. I know. It's my pleasure. And, it feels like since we started like spreading this out in the world, it just feels like there are so many forces for good in the horse world right now. There are people trying to change the way, tack is used in the show ring, people trying to change what are the standards for horses, enrichment and lifestyle. I think that it's a movement that's growing, and the horse world that we grew up in 50 years ago is just not the same as it is now. And that's a very good thing.
Yeah.
I
And
think that we're learning so much more.
absolutely. And, when I was on Long Island, Dr. Shoemaker used to come out to Long Island. She was in Pennsylvania, or I don't know, she still is in Pennsylvania. Um, and she would come out to us, and then there were a couple horses that I started bringing them to her. So I drive 4.5 hours so that these horses could have visits with Judith, and she absolutely changed their lives and saved a couple of them just
Oh,
by
yeah.
rehabbing, horses that I had one that, I knew its feet weren't good, and I brought it to every farrier whenever I was at a CDI show, like a big show. I would always go to their farrier and I'd be like, what do you think about his feet? It's like, oh, that's the best you can do. And Judith was the one who just helped me really see something I couldn't see at the time, and saved that horse and saved another horse that had some head shaking stuff. And she turned it around. And anyway, she's amazing. And so the fact that she is out here and available and accessible is pure gold. Pure gold.
Yeah, she's just such an endless wealth I mean, my hard work is sometimes not letting her go down every wormhole
She's very
because
generous.
there is not enough time in the world to learn everything that is in that mighty brain.
Yeah, yeah, but let's try.
Yes, yes. That's why I
Oh,
like to hang out
goodness.
with her.
No, and you two are a really good blend, because yeah, the information that you have and your ability to sort of structure and organize, and then Judith's creative genius are really a nice blend. So
It's also like the
anyway,
practical applications. Like I'm, like the nerdy scientist, and Judith is like, she's seen 4,000 horses with that problem, and she can tell you how it turns out when you do this, when you do that, when you do the other thing. And, we need all those different approaches in order to give our horses the best life we can.
awesome. Thank you so much for taking this time to be here
Thank you
today.
for having me back on the pod.
Yeah, well, hopefully we'll do it again sometime.
Absolutely.
Awesome.
Absolutely.
All right. Thank you, Anne.